Yeah, I do actually today. So one thing, there was a change in our agenda. We'll be adding the topic of alcohol density to the agenda today, as it was supposed to be on, but it didn't get on our agenda when we sent it out. So that will follow the Fargo Youth Initiative agenda today. So if you can add that to your lists. Second, our budget meeting for Board of Health is scheduled currently for May 28th. I think we've sent out correspondence on this to most of you and have heard back from a few of you. Since that's Memorial Day weekend, we kind of thought it might be good to see if we could move that up to Thursday at noon, the 27th. So we'll be waiting to get confirmation back from all of you to make sure that that works. But there again, that's strictly the budget meeting for Fargo CAS. And then I'm sure most of you are aware of Dr. Lako's death the end of March. So obviously she wore many hats in our community, and one was being our health officer. Really grateful for her and appreciated her service, and she'll be greatly missed. We are in the interim, so you guys know Sanford has graciously volunteered to assist us with our health officer activities until we can find a replacement for that. So Dr. Griffin is helping us with that. The city will be releasing a request for qualifications starting on the 21st to find a replacement. So for this group, if you know any physicians that would be eligible and interested, please share that opening with any and all that might have an interest in that. And then just lastly, I just wanted to mention that I start my medical leave on Monday in Minneapolis, so I will be working remotely and intermittently for a few months. So email is probably the best way to reach out to me, but certainly if you have an immediate need and need someone to talk to right now and can't get a response from me, please call the office and they will direct you to one of the management team. And that is all I have.
Okay. Thank you, Desi, and best of luck on leave. We'll try not to bug you. Okay. So I think next we have the Fargo Youth Initiative presentation. I think that was sent out ahead of time as well, if I remember correctly.
Yeah, so we're ready to start. Can everybody hear me okay?
I can hear you.
Okay, perfect. So hello, I'm Erica and my partner is Sam for this presentation. We're both on the Mental Health Committee for Fargo Youth Initiative. Thank you for listening to us today on policy analysis for improving youth mental health in Fargo. Let's jump right into things.
I just want to say I'm Sam and my camera is having a little bit of trouble, so if you see a black screen, I'm still here. So we are a youth-led group with a mission to unite the youth of Fargo through actions and teamwork and provide a positive and sustainable impact on our community. So over the past year and a half, we have used policy analysis framework to analyze how to improve youth mental health in Fargo. And since mental health is a key component of public health, we are honored to be here today and share our process and our top findings and next steps.
So our first step in the process, we tried to define the problem. We did this by collecting information to help narrow down some of the main issues that we found. We definitely focused on youth, and we found that 50% of mental illness begins by age 14. We also published a survey. We combined it with the racial inequity survey, and we had almost 500 responses split evenly between North, Davies, and South, with freshmen being the highest respondent. The Black and African American survey was fairly representative of FPS. And we also conducted interviews over the last few years. We did this with Level Up, school counselors, Student Wellness and Family Facilitator Mary Kruger, the Rape and Abuse Crisis Center principals, Commissioner Gehrig, and Mayor Mahoney. You can see some of the top problems that we identified to the right, with stress, lack of professional support, and a stigma being the main ones.
So as Erica said, one of the problems was that too much school-related stress greatly affects youth mental health, and several survey responses cited schoolwork as a primary cause of mental health issues. Many respondents also reported struggling with non-flexible faculty members who did not understand student mental health. And our survey also determined that only a third of students felt supported by their community in their mental health struggles.
Our next main issue was a lack of professional support, and it was very unclear if school counselors were available to discuss or treat mental health issues. We had some very negative responses about students' interactions with their counselors. And then another thing we found is that 45% of respondents did not discuss mental health at home, and they do not feel supported by their parents. 92% of respondents report that they feel at least somewhat adequately informed on mental health, but we saw a general trend that there was a lack of transportation or finances to help with some issues that may arise. We also found that about 25% of students do not know how to support a peer or a family member when it comes to mental health difficulties.
So when defining the problem, the third conclusion we came to that there is too much stigma around mental health and not enough meaningful discussion. Our survey concluded that over 60% of students reported that they were not talking about mental health in school. Also, our data concluded that 1 in 6 students felt that they have no one to talk to about mental health.
So after we have defined the problem, we tried to find some alternatives and we evaluated them on some criteria. So first we brainstormed over 30 ideas, like any solution we could think of. Then we narrowed the list based on how they addressed the problems we identified. And we ranked the final 10 based on effectiveness and funding resources. For effectiveness, we define this as according to our experience as students and on scientific research, how well would this improve our problem elements and how many students would this benefit? And then for funding and resources, we decided this on relative to our alternatives. What is our best estimate at how much this would cost in terms of staffing, education, and any other potential costs we could think of? Okay, so then we created some outcomes and we ranked them on most effective to least effective. So let's briefly walk through all of them. So first, we started with reducing the homework policy. We've included 2 evidences for this because we understand that we're high schoolers coming to you asking, let's reduce homework, but we want to make it very clear that we're not just kids talking to you about this. We saw that reducing homework actually has a significant impact on relieving stress and helping with mental health issues. Our second was mandatory mental health appointments. So we know that this is at least one mandatory mental health appointment, but it would be most value to reaching a wider number of students because most students are unlikely to just opt in for several reasons. Our third idea was free in-school therapy. We know that while counselors may technically be available for mental health, that is not the perception among students, nor do they have the capacity for more long-term intensive therapy. Our fourth idea was a mental health club. With sustained structured support from staff, this could be a reliable way to create peer support. North High is currently setting an example, but we would like these to be as much evidence-based as possible, where there's a very clear curriculum and some staff support. Then for our fifth idea, we had free texting therapy. We know that in-person is optimal, but everyone needs it, but not everyone who needs it would opt into this. This would be good in combination with another solution like free in-school therapy, having both and not just have this be our only solution. And then Sam will finish the next 5 for us.
So our 6th outcome was a parent education campaign. Now, parents are unlikely to just opt in and participate in this, so it would need to occur at a time when parents are required to participate, whether that's through registration or directly from a teacher. Our 7th outcome is survey check-ins from counselors. So this, since it's not that strong of an idea, this would also be best combined with another method, and it would be able to make a huge difference and also a good short-term, easy solution. Our 8th outcome was the anonymous encouragement drop box. So students could receive anonymous notes of encouragement, but this method would not make as big of a difference as our other ones. Our 9th outcome was the teacher mental health training. The evidence shows that training sessions to improve teachers' ability to help students with mental health has low effectiveness, and we know teachers are already stretched thin as they're already teaching us, grading our schoolwork, coming up with new lesson plans, etc. This is different and less specific than the earlier alternative of reducing homework, but it's still an option we came up with. And lastly, our final outcome is status quo. This is harmful for many reasons, as it's hard to talk about mental health and it would be difficult to eliminate.
So, first of all, I'd like to recognize that your agencies have several work plan priorities, some of which already may address youth mental health goals. We didn't have time to speak one-on-one with every stakeholder, so we are grateful for this meeting for so many experts, and we want to learn more about existing efforts that align with these ideas, their feasibility and their costs, and what we can learn about existing efforts and what the best steps to take forward. So first, we would like to hear your feedback. Then we would like to create a task force. We were thinking this could be comprised of stakeholders along with Fargo Youth members, specifically Sam and I and some other members that are on the mental health committee. And then we would like to allocate funding. I'd like to note that we also have plans to present to the Fargo Public Schools, any city commission, and would appreciate your support for these.
Okay.
Yeah, this concludes our presentation, and thank you for listening.
Well, thank you, Sam and Erica. Very informative. That was going to be my first question, is if you were presenting to the Fargo School Board. So glad to hear that as well. So feedback from community members, board members here.
This is Lynn Telford, and I just want to say excellent job. What an important, that's just such important work, and we're seeing so much more acute mental health needs, especially because of the pandemic. So pretty timely. So just really appreciate the work you guys have done and for bringing it to us, and really encourage you to bring that to the school board and city commission. And I could, imagine the Board of Health just supports that work in general. So nice job.
Thank you.
This is Dr. Lavalla. I also would concur with my colleagues. Great job. I really appreciate that some of the students are taking the steps to notice this and try to do something about it, and not just go based on the literature, but actually trying to research within the school so you have actual numbers that you can bring to the school board for the kids that are in this district. And yes, along with what Lynn said, the rates of mental illness have significantly increased. There's a trend upward of rates of mental illness increasing just in general. I just finished a presentation on it today. The rates have almost doubled over the last 5 years, 19. And then in 2020, the rates have significantly jumped exponentially even beyond that. So I think it's really timely that you're doing this, and I think there will be a lot of support. And definitely, I support you guys. So, nice job.
Thank you.
Thank you.
This is Arlette. I'm just sitting here thinking, oh my gosh, this is a really important issue, especially now with the pandemic. But the information is extremely well thought out and well researched. So I commend you on that. Desi, I'm wondering if you could speak from the health department or the the perspective of your work plan, your community improvement plan, and how this fits in. And then secondly, if there's any kind of, is there any kind of state funding that's available for pilot programs such as this? Do you know of any?
I'm not sure if there could be, like, through Department of Human Services. So right now, with our community health assessment, that process is just wrapping up. So with that, behavioral health has been identified as an issue previously. The problem is, and Justin, you could probably correct me on this as well, if I don't know that they break it down between youth and adults. I think it's just more kind of categorized as behavioral health. So that would be something, it's identified in the plan, and it would go forward in an improvement plan, but we may have to at our level make steps to break that down more into adult versus youth and have activities for both. So that would be something that we could look at. Sanford is kind of spearheading the process of that. So I assume within the next month or so, we should be getting data from all of the surveys that they sent out to the community and see what the feedback would be for this time going forward.
Any current programming, Desi, that is currently in the works or out in the community that kind of nicely aligns with the effort that's being brought forward here?
You know, from a mental health standpoint, there may be specific things like that Southeast does. Okay. You know, we have it, it's kind of woven into a lot of our programs, like I'm sure even in the tobacco programs, things like that, you know, it's a part of it. When you're looking at why are kids using substances, you know, some might be due to mental health issues and that cause and effect type of thing. We don't have anything specifically geared towards youth mental health in our agency. You know, we have the school nursing program, and obviously they deal, you know, one-on-one with kids and may run into that quite a bit within the school setting. We don't have any group type activity programs that we have here currently.
Okay. So imagine. Oh, go ahead. Go ahead, Justin.
So there was the Rethink Mental Health initiative that we were working on with Clay County as well. And then, you know, COVID kind of hit and a lot of the activities and stuff sort of fell by the wayside for that. So I'm not sure exactly what the plan is when it starts going again, but I know we were just gaining momentum with some of that too.
Okay. Definitely. So Desi, I would think that the school nurses have established relationships with the school counselors and make the appropriate referrals, and all of that's kind of happening within each of the schools. It sounds like what Sam and Erica brought forward, at least one of the issues that was identified is the kind of lack of professional support and knowing that the counselors are there. And so I don't know if there's things that the school nurses can do to help with that, or if that's already being done. But
yeah, and I think we can make an effort going forward. You know, once we get that community health assessment data back, you know, we can kind of tailor that a little bit for us too, and in conjunction with Clay County Public Health, and add in a little bit more substance for the youth mental health initiative by separating out behavioral health and making sure we have a little bit for adults and some for youth as well.
And I know currently in our public health clinic, we ask and do depression screenings for every individual. We do serve quite a few adolescents in our clinic, and it's unfortunate. And in the presentation today was outstanding. And, you know, it's unfortunate that we still have that stigma. And just the more that we can talk about mental health, the better. And what really struck me is, you know, the statistic that I wrote down, one in six feel they have no one that they can talk to about mental health. But that's something here in our clinic that we feel very strongly about, and that, you know, we talk about depression, mental health with every client that walks through our clinic doors, and we feel that's extremely important. Now, currently, we are getting funding this year to do that, but there were years that we did not get funding, but we felt so strongly as we just continue to do that, because regardless if we get funding or not, we feel that's a very important component to the services that we provide to the community.
You know, I just think it seems like this is an issue that runs across a number of jurisdictions. And as you, Sam and Erica, as you present to the school district We, from the city perspective, have joint meetings between city, park, and schools. Obviously, this would also, I think, go into the park district purview as well, because they certainly serve the youth in our community. It just seems like this would be a really good topic or issue for the group to take a look at and see if there's some joint efforts that we could do.
And that's a great suggestion.
Yeah.
Any other feedback for Sam and Erica? And it sounds like there's a lot of energy around this, a lot of opportunity. I think, you know, like folks have said, this is definitely very timely. I think you've done a very thorough job of researching, you know, the different options and getting feedback from the youth, which is certainly important here. So sharing with the school board and the city commission and the park board together might be a really great next step. Sounds like, you know, there's some overlap between, you know, what the health department does, and then certainly the human services centers also play a part in this as well. So I'm trying to think of venues to hear this information. And, you know, Desi mentioned Southeast, and I don't know if they have a board or anything that, or some type of setting in which this would be available, or something that would be important to bring forward. But seems like we need to make a connection with DHS somehow.
Yeah.
So a couple other things, Chelsea. Lori's sending me messages. We must be having some technical issues for Amy and Kayla. So Amy had said, her microphone's not working, but she recognized a good resource is, I don't know how you pronounce it, but it's NAMI is a really good resource for mental health support and advocacy. And then she said, secondly, that in Erica and Sam's presentation, they talked about teacher training, and she said that was expensive to do that. Kayla from Family Healthcare said here in Fargo, Family Healthcare can almost always provide affordable healthcare and mental health care to anyone in need. So with those with financial concerns, you know, Family Healthcare is a good option for that as well. So.
And that was NAMI, I think is
yes.
what, okay. Okay. So plenty of ideas.
Yes, thank you so much.
Well, thank you. We really appreciate both you and Sam bringing forward the information. Is very helpful. And if there's anything that we can do to help support, I think you heard from most of the board members, and we're all excited and behind you in this one. So if there's any like formal support or anything that you need from us, I think we'd be more than willing to do something like that. So let us know, Commissioner Preston, if you can let us know if we put this on a joint agenda, if that's something I would love to attend to hear as well. If you can just send a note out to the board, if that gets scheduled, or I can look for it as well, but.
Sure.
Okay. Thank you. All right. Okay. Well, I think there's a couple of others that have joined us. I think there's some folks that have phoned in. So is it possible to just get the callers?
This is Dwayne Breitling, and I called in.
Okay. Thanks, Dwayne. Anybody else? Sorry, who was that?
Jane Elias, and I called in.
It was Jan Elias.
Oh, hey, Jan. Okay. Excellent. And I think we have enough board members now. Can we revisit the meeting minutes from last time? Is that okay, Desi, if I slide that in before we talk about alcohol density?
You can do whatever you would like to.
All right. Excellent. So The meeting minutes were sent out, or I believe yesterday. Does anybody have any changes? Otherwise, I'd entertain a motion to approve.
So move. Breitling.
Thank you. Anyone second?
This is Lynn, and I'll second.
Thank you, Lynn. And since not everybody's audio is working, I'd have to do a chat if you disagree, but all those in favor say aye, or unmute and say aye.
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 Thank you. Anything in the chat, Lori? Probably not.
Yep. Kayla, Amy, and Lynn have all said aye.
Okay, perfect. Thank you. All right. Okay, let's move on to alcohol density, which was sent out, I believe today, early this morning. There was a PDF that Lori sent. So that's next. And Robin?
Okay, well, I'll just say a few words first, and then it'll be Robin. But I just wanted to say good afternoon to the Board of Health members. Some time ago, Commissioner Preston and I communicated, and she informed me that she was interested in a discussion related to alcohol outlet density. And when we talked, I felt that it was very appropriate to bring it to the Board of Health, since alcohol outlet density is a public health problem and can lead to a variety of negative consequences. Yes, Robin Lidkesel, our substance abuse prevention coordinator at Fargo Cass Public Health, is extremely knowledgeable on alcohol outlet density, as well as many other substance use and abuse issues. And she has put together a presentation for you today, and I looked through it and it's outstanding. So I'm sure you'll learn a lot. I know I did, and I'll continue to learn today. So with that, I'll let Robin take it from here.
Is Robin having issues with audio?
Yep. Robin?
I think they're going to go check. If nothing else, maybe we can have Robin go to Larry's office if that would work, if her audio doesn't work. We'll play musical chairs. I think we've done this before.
Can you hear? Hi, can everyone hear me?
We can hear you.
Great. I apologize. I tested this at 11 o'clock today with Brian in the commission chambers, and it worked perfectly. So I'm not sure what the issue is, but I apologize. So yes, thank you for having me today to talk about alcohol outlet density. And it looks like I'm not going to be able to share my, someone's going to advance them for me. Great. Okay. So my objectives today are to define alcohol outlet density, as well as identify problems that occur as a result of having a high alcohol outlet density, as well as examine different types of regulation for AOD. And we'll also take a look at Fargo's AOD based on an assessment that we did spring of 2018. So first, to define what alcohol outlet density is, it's the concentration of retail alcohol establishments, including bars, restaurants, liquor stores, package stores, in any geographic area. And alcohol density, if the alcohol density is high, there are several problems that can result as a consequence of that. So if we have a high concentration of alcohol outlets, that can lead to, or it does lead to, actually there have been many, many studies done on this. So it leads to excessive alcohol consumption, which is definitely one of our biggest problems here in Fargo. And in fact, we have in Fargo, we've been named the drunkest city several times, so we know we have that problem, as does the rest of the nation. It also causes serious health consequences, social consequences, violence, alcohol-impaired driving, neighborhood disruption, and public nuisance activities. And it's also a major public health problem because it significantly affects the physical availability of and cost of alcoholic beverages. So how can we regulate this? So regulation has been heavily studied, and it is highly recommended in a number of studies. But one area where it got a lot of recognition was in the CDC's community guide back in 2007. They definitely it was definitely a recommended strategy, a proven strategy, in fact, for preventing excessive alcohol consumption and the related harms. So as an effective strategy for limiting the availability of alcohol, it reduces excessive drinking, health consequences, and social consequences. So there's 4 different options when it comes to regulating alcohol density. There is the geographic, and basically that is a limiting of the number of alcohol establishments per geographic unit. And that geographic unit could be a block, it could be a area of town, it could be a beat. I know that we have beats here in Fargo, or used to, for our police, things like that. There's also population level regulation, which would limit per population, and that could be per population of a geographic area, or it could be the population of the entire city. And in fact, this is actually one thing that we do have here in the city of Fargo. We do have the number of our our Class A liquor licenses for bars, and that does not require any food at all. So there is a regulation that every time there is an increase of 10,000 people in our population, one of those types of licenses can be added. But it should be noted that Fargo has, I believe it's up to 26 different types of licenses now. So really, that's the only limit that we have, or regulation that we have when it comes to our alcohol licenses. And there has been some talk and some effort by some of the members of our Liquor Control Board to actually remove that completely. So that could be problematic. The third type of regulatory option is commercial. And what that does is it caps the percentage of alcohol outlets in relation to the total number of retail establishments in a geographic area. So, for example, it would say only 20% of retail establishments in downtown, for example, can sell alcohol. So that would be an example of that. Another regulation would be space, and that limits location. So, for example, you can't have alcohol outlets near schools, near churches, near a park, things like that. Or it sets a minimum distance between outlets, saying that you can't have 100. There needs to be 100 feet, between alcohol outlets, for example. That actually is one other regulation that we do currently have in Fargo. There is a regulation that states that any liquor store, so any off-sale liquor licensee, has to be 100 feet from the entrance of a grocery store. So basically what that does right now is it does not allow for alcohol to be sold in grocery stores. For example, if you've been to Costco in West Fargo, you see that there is a separate area within that store that you can buy alcohol. And that's because they don't have that 100-foot rule that we have here in Fargo when it comes to off-sale alcohol. However, that is another area that has been discussed and looked at, and there have been some people that have been very much in favor of removing that 100-foot limitation. Another regulatory option would be time, and basically that just limits operating hours. But there's a lot of research out there that says that if you limit operating hours of alcohol establishments, it can greatly mitigate some of those density-related problems. And so anytime we hear about alcohol being sold for, longer hours, to the regular person, they may not think that's a big deal, but in fact, many studies have shown that it is a big deal, that the more time that alcohol is available, the more alcohol-related problems we have as a result. Okay, so I just wanted to provide some resources. There's 3 really good resources on this topic if you want to do some more checking yourself. Of course, I already referenced the community guide, so there is the link for that. It's the CDC's community guide on preventing alcohol, excessive alcohol consumption, evidence-based interventions for your community. Then there's Strategizer 55 that came out of and after the community guide, and it is an action guide to regulating alcohol outlet density in your community. And then the last link there is a guide for measuring alcohol outlet density. It is definitely recommended that public health routinely monitor and measure what the alcohol outlet density is for any given community, because oftentimes those types of things are not in place through any other organization. And so oftentimes it's left to us at public health to keep an eye on it and let our leaders and officials know when it's becoming problematic. Which leads us to our problems here in Fargo. So I just wanted to remind you all of our alcohol-related deaths according to the Cass County coroner. Last year was particularly deadly. We had 72 alcohol-related deaths in 2020, and those would be deaths that resulted as that were alcohol related. So someone that died as a result of an injury, violence related to alcohol, or someone who died from a long-term illness as the result of alcohol, like cirrhosis of the liver, for example. So like I said, we definitely know we have a problem here, and the nation knows we have a problem here because we have been relegated the drunkest city in the nation, many times. So now I want to really quickly give you a snapshot of what we found when we did the 2018 assessment on alcohol outlet density. And please bear in mind that this was a very simple version. If you read that guide that the CDC published on how to do one of these, you could literally spend years and thousands of hours on doing this. But we felt that just by doing a simple one, it did really give us kind of a better snapshot or a better idea of what was going on in Fargo. And I really like this slide because it really hammers home how densely alcohol establishments are in downtown Fargo. And most of us probably already knew that, but here are the numbers, the data, and numbers don't lie. And what it shows here is that we have 1 alcohol establishment for every 95 people in downtown Fargo. We also took a look at 2 other areas where there was a lot of alcohol density. That was the 13th Avenue South Corridor, as well as the 45th Street South Corridor. So we took a look at that. And even, and those 2 corridors were fairly dense as well. However, we're going to take a look later at the area, at how big of an area downtown is versus how big of an area 13th Avenue is or 45th Street South is. So if we take a look at this slide here, it looks like, well, downtown has relatively the same amount of establishments per person as 45th Street South. But when we take a look at the size of those areas, they're much different. So the other thing I wanted to also point out with that last slide is the fact that if we look at the alcohol density for the city of Fargo, we have 1 outlet for every 632 people. And I'm thinking at one point in time that a prevention recommendation is that you not have more than 1 alcohol establishment per every 1,000 people. So we have a high alcohol density, definitely in downtown, definitely 13th Avenue, definitely 45th Street South. But even in the city of Fargo itself, if we take all of the massive area that our city encompasses, we still have a high alcohol outlet density in the city itself. Okay, so now we're going to take a look at the square miles of those 3 districts that I spoke of. So downtown, the area that we looked at was only 0.24 square miles, okay? And what we found is that in that 0.24 square miles in downtown Fargo, there were 42 establishments 42 alcohol establishments. Then if you take a look at 13th Avenue South, we took a look at an area that's 1.53 square miles, and there were 29 alcohol establishments. And then for 45th Street South, we took a look at 1.11 square miles, and there were 36 alcohol establishments. So this slide here really shows us that there is a cluster. That is actually the technical term for having a lot of alcohol outlets all in one area, and that's a cluster. So we definitely have clusters in all three of these areas, but the most severe cluster, if you will, is downtown Fargo. Another thing that should be noted about downtown is that there are a lot of licenses down there that are strictly bar licenses that don't have the food requirements. And so you're going to see different behaviors out of the patrons that go to those types of establishments versus if you think about 13th Avenue, it's basically, bar and grills, restaurants, things like that. So downtown is kind of really packed a double or triple whammy here when you look at the area, when you look at the density, how many establishments per person, and then you look at the type of licenses they have, as well as what the occupancy of some of those places are. Some of the places downtown have a extremely high occupancy, so they can pack a lot of people into just one alcohol outlet, whereas on 13th Avenue, you may not be able to pack as many people in. So other considerations as well. There's many considerations when it comes to this issue for sure. Okay, so now we're going to take a look at crime, and this is Fargo Police Department data. It's 6 months from September 2017 through March of 2018, and we took a look at crime or incidents, if you will, in all three of these areas, and just wanted to show how much crime was happening, because one of the big arguments against having a high alcohol density is that it leads to crime, especially violent crimes, and especially among younger adults. And so if we take a look here, this is just a look at the property incidents. And of course, we see a lot of those on 13th Avenue. But it is worth noting that a large portion of those happened at Walmart's address. I don't want to say it was at Walmart specifically, but that was the address of the location of where these incidents happened. So that's what property incidents look like. And as you can see there, if we compare downtown to like the 45th Street corridor, which is a lot larger area again, remember, that we see, pretty equal or even more property incidents downtown. All right, on our next slide, we take a look at violent incidents. Again, Fargo Police Department data, again, the same time period. And again, we compare downtown with 13th Avenue and the 45th Street corridor. And if you take a look at the violent incidents, the number, especially if you look at Thursday through Saturday from 6 p.m. to 6 a.m., look how many violent incidents happened in downtown Fargo. Not good. And a lot of people, or at least the science would say, a lot of that is related to the alcohol density. The other thing I wanted to note too is that, some of the numbers for 13th Avenue are definitely higher for the 45th Street numbers. But again, we did see a number of those violent incidents coming directly from Walmart's location. So there is some correlation between Walmart and violent incidents. And after seeing this data, I'm wondering why I shop there. But anyways, so this, yes, definitely shows that there is that correlation between the busy bar hours and violent incidents. And that's because when you get all these people in a very small location, it encourages people that are traveling in between establishments to be aggressive towards each other, to start fights, things like that. We've even had murders downtown as a result of a bar fight. So this does happen. All right, the next slide is going to show quality of life incidents. Now, quality of life incidents would be loitering, panhandling, different things like that. And we often hear about complaints. I believe that this probably has gotten worse in downtown Fargo. At least that's what I've been hearing from other colleagues of mine, that especially over COVID, that downtown, the quality of life incidents have really risen dramatically. So this data definitely does not reflect that, if that's the case. But again, this just shows quality of life incidents and There's obviously there's plenty on downtown 13th Avenue, 45th Street. But again, if we take a look at Thursday through Saturday, 6 p.m. to 6 a.m., we have 53 of those incidents in downtown Fargo. And like I said, I believe that they're much higher nowadays. That 13th Avenue corridor, I see a lot of panhandling along that corridor. So I'm thinking, that a lot of their high numbers are correlated to things like that and so forth. The next slide is just a total of all of these incidents, the quality of life, the violence, and the property crimes. And so we can just take a look here and see how many we have in each of those areas. And again, just remembering what those area sizes were. Downtown was 0.24. The 13th Avenue corridor was 1.53, and the 45th Street corridor was 1.11. So kind of keep that in mind as you're looking these over. So this just gives you an idea of the types of information that can be mined and put together for an assessment to see if there is a problem. Now, I'm pretty sure if we were to take this data and compare it to data from more of an area of town that's, more of a neighborhood, I'm thinking that a lot of these numbers would be a lot lower. So it definitely shows that, if you have those alcohol establishments, definitely you're going to see these types of crimes, and many studies have proven that. So in summary, this was just kind of a high level look at alcohol outlet density. Like I said, there are thousands of studies on this, and there's so much more information. We probably could do an entire week-long conference on it if we wanted. But this was, I guess, a starting point for me. And so if there's more information needed or wanted, I definitely can provide that, or we can look at other facets of this. But in summary, I just want to relate again that high alcohol outlet density does lead to excessive consumption and serious health and social consequences. Fargo obviously has a high alcohol outlet density and associated consequences, and much worse in areas like downtown 13th Avenue and 45th Street. Regulation of AOD can lower excessive consumption and reduce health and social consequences. And there are regulatory options that we can implement in our community going forward so that we don't continue to see the clustering that we see downtown and in other parts of the community. And there is a lot of information out there and a very great community action guide put together by CDC that could help us, with this regulation if we were looking for guidance on it. So that's all I have, and I would welcome any questions that anyone might have.
Thanks, Robin. I would love to see updated numbers on this. Like you mentioned, I think there's probably some shifting maybe in some of these incidents. But I also wonder, has this information ever been shared with the Liquor Control Board?
So the information on alcohol outlet density, just as a concept or as a prevention strategy, has been shared with the City Commission and the Liquor Control Board. However, that was back, in 2018. It was also shared with the mayor, and I even, gave him information, but it was a while ago. So it might be something that we would want to renew. And the assessment information, I'm not quite sure how far that got. I know that I did, that it was given to members of the Downtown Neighborhood Association, and I believe they may have shared some of it with the Liquor Control Board. I'm not quite sure on that. Arlette might be able to answer more on that.
Okay. It just seems if there's some pieces that we have in place that folks are trying to kind of scale back, that this would be good information to remind them of why they're in place. So I don't know, Arlette, do you have anything to add here?
Sure. Thank you, Robin, for presenting this. I don't think I was active at the Downtown Neighborhood Association before I got on the commission. And I don't think anything was shared with the Liquor Control Board from our perspective back then. But just to let everybody know, the Liquor Control Board is undergoing some major changes. We are changing up the membership totally. So in the next month or so, it'll be a whole new board. And I think it would be really wise to perhaps try to, once the members get their feet on the ground a little bit, try to present this information to them. There was a lot of activity from the Downtown Neighborhood Association to try get the City Commission and the Liquor Control Board to look at some kind of density standards, but that never happened. So, I think Robin's information just, and it being research-based, I think is so important that it shows that higher density increases consumption. And we, as a community, in fact, if I can give you a little bit of history, way back in the early 2000s, we had Mayor's Task Force on alcohol, or actually it was Mayor's Task Force on addiction, and alcohol was what was driving it back then. And across all 4 jurisdictions, we developed strategies to try to address this, but it never got up off the ground. So it's an issue that we've been struggling with for a long time, and if we can get it back up on the table somehow and see that it gets discussed, that would be wonderful.
Thank you, Arlette, for the background. Other folks have questions for Robin? I think given that the Liquor Control Board, I assume that's one of the places that they're trying to maybe scale back some of these items. So I think that's a good place to start in terms of educating on the importance of this and the things that we can do to help kind of curb the issues that we're having related to density. But anybody else have any other ideas on how to bring this to the forefront, or other groups that maybe are trying to address it, where Robin's information might be really helpful?
This is Lynn. So I was also thinking about is it the Planning and Development Committee or the Planning Commission, where, as we look at the growth in South Fargo, especially, how do we take into account those things so that they don't have such a density as we start developing new parts of the city. So that might be another option.
Great suggestion. Robin, have you ever had any conversations with the planning folks?
I haven't. I have read some documents where this type, planning documents specifically where this type of information is included, but it isn't up to them, when it comes to handing out a liquor license. Maybe if, they had some input on it, but to my knowledge, they don't. They zone something retail, and, if a bar wants to go in and the Liquor Control Board gives them the Liquor Control Board recommends giving them a license, and then it's granted to them from the City Commission, it really is out of their hands.
Okay. Any other ideas or questions for Robin?
This is Desi too. I was just going to add that, we hope to this year, we know that alcohol use is an issue for adults in this community. And in years past, we've kind of danced around that a little bit because it's so woven into our culture here. So, we're hoping to start kind of doing some messaging around that throughout the year with some of our substance use grants, and to kind of get a harm reduction approach out there for alcohol as well. We can do harm reduction stuff for opioids and all the other drugs, that alcohol is a needed thing too. So we know we aren't going to be popular if we go with the message that people shouldn't drink. But how can we get people to drink safer and causing less harm? So hopefully that, along with these types of data studies will help kind of start putting the message out, maybe changing the perspective a little bit.
Desi, this is Arlette. Is that something that's far enough along? Do you have something you could present on harm reduction for alcohol? That might be real interesting.
Yeah, that would probably not be far enough along at this point. But I suspect that it won't be too much longer. It's just kind of shifting the focus from where we've normally been, and kind of getting that out into the alcohol world a little bit. We're, kind of if we could get some of that community health assessment data, that might support to some of the issues going on in the community. That might, it's kind of good to have that backing before you start, putting the message out there, because it will, not be received well by all. And coming off a pandemic where people are maybe tired of hearing from public health, and timing may be best to wait a little bit as well, but certainly it needs to at some point. And I think we're just going to have to go softly for a little bit just to kind of start getting the message out.
It seems like at least the community health needs assessment and the other work that you mentioned, Desi, is kind of coming together. That might be a nice complement to the information Robin presented. I don't know, Robin, if you've looked at information for West Fargo or the rest of Cass County, but it seems like it kind of goes beyond just Fargo. Let's look at some of the other areas and how do they compare. I think the national stats or, the recommendations that you shared related to, the density versus the number of folks, and how where we sit currently is all very helpful perspective for folks to understand. We just bringing that awareness that the more establishments we have, the closer they are, the more people that are clustered around that, we're going to have more problems. And so keeping that in mind and letting that sink in for some folks, I think it's a good start, certainly. Okay. Well, I know we're almost at time and we have plenty of other things on the agenda. So Desi, any thoughts on what you would like to get to? I don't know that we'll be able to get to everything.
I think, budget-wise, we probably don't have to do a lot with that. If you guys have questions, you can email, and we can certainly answer any questions. I know with the, COVID operations, I can probably just let Suzanne speak just a little bit on the vaccine part. That's probably the main mission and what people are most curious about. So maybe Suzanne, if you just want to give a brief update on vaccines, that would be great.
All right. Thank you. Yes, I do have just a very brief update. We all heard earlier this week, I'm sure, that Johnson & Johnson was put on a pause due to some side effects that were pretty alarming, and so that is being reviewed by ACIP before it would come back to us to give those vaccines. We also know that the side effects were rare, and so we, are reminding people of that as well. And the fact that the safety signals were picked up early was a good sign as to what our vaccine program is doing and how they are working through things. So we're very, very happy that it was picked up as soon as it was, because it was a very severe side effect. It didn't affect us a whole lot here for our operations because we didn't have a lot of Johnson & Johnson coming. Our allocations were pretty low. We did have one clinic scheduled for next week, and those individuals are being contacted and being shifted and offered Pfizer or Moderna vaccines at a different time. Also, just as a note, there's decreased demand for vaccine that has been seen, and it's not just Fargo Cass Public Health that has been experiencing it. It sounds like it's kind of, for the most part, kind of hitting all providers a little bit. And so we are working on plans to shift our focus a bit from just mass vaccine distribution to maybe some smaller clinics and some more mobile missions. Still working on those plans, but those will be coming up soon. Otherwise, just as a final wrap up, Cass County as of yesterday had administered 128,350 doses, and Fargo CAS has administered 41,548. So very proud of all those operations that are happening. That is all I have.
Thank you,
Chelsea,
Suzanne.
if I could,
yeah, of course.
If I could just add something in here. The mayor and I specifically have been talking quite a bit about the vaccination level that we're at currently, which, if I'm not mistaken, Suzanne and Desi, is around 50% and needing to get up to that herd immunity. And the fact that we backed off the mask mandate and things are loosening up quite a bit. Larger events are happening. It's a little concerning that our numbers are as high as they are. So trying to, and I appreciate Suzanne's comments about kind of changing the focus perhaps to some mobile kind of outreach for vaccinations. But, it's going to be that last 15 to 20% that is going to be really tough to try to get. And having to be as creative and, as creative as we can to try to achieve it. Otherwise, we're going to be living with this for quite a while, and that's a little nerve-wracking.
I know that there's certainly where companies are kind of tracking their immunization rates. I know that I had shared with the state health department just some Blue Cross stats amongst our high risk folks. So just trying to make sure that those that are, higher risk are getting in and getting their vaccinations. But I agree with Arlette. It's going to be tough to get the last percentages there. And certainly the news of Johnson & Johnson probably isn't going to make it any easier. So, as much as we can do to promote the safety and efficacy of those vaccinations, and then continue to encourage folks to get one. I think there's a number of companies across the state that are trying to do their part in doing that. I don't know if there's anything from your perspective that you think the board could help with, Desi or Suzanne, that would boost that effort. But certainly willing to look at any ideas or thoughts on how we can help that. I'm sure the healthcare providers are also very engaged in reaching out to folks that they know haven't received it as well. So,
yeah, I think we've found that, obviously healthcare provider is what they keep telling us is one of the main driving factors. And so I think really if the major health systems can use their electronic health records to reach out to people, either with, personalized doctor messaging or something, to encourage folks. And then if we go down this path of doing kind of smaller missions in different places, different things, I think, that's kind of reaching that gap service. And that's kind of where public health tends to be, with the vaccination as it is ongoing. And so that's kind of what our hope is. And then just to up our messaging, we've just tried to up our messaging for general messaging. There should be more messaging coming out as well as for special populations.
This is Lynn, and I was curious about some kind of campaign, a public health campaign for herd immunity, and that has information to encourage those who are vaccine hesitant. There's a lot of good educational materials for vaccine hesitancy, which is an understandable thing with new vaccines. But, when we talk about returning to normal, there's a couple of ways to get there. And like Arlette said, if we don't do these things, we're looking at masks really necessary for a much longer time.
And the city is going to be working on a campaign. The state is working on a campaign. We'll be partnering with Ashira to work on some of their media campaigns. So there will be several efforts going on here in the next little bit. So hopefully that will help as well.
Okay. All right. Well, let us know if there's anything that we can do to help in terms of the campaign, and I'm sure Miss would be willing. Anybody on the board would be willing to help promote that. So, all right. Let's see. Do we have enough time, Dizzy, to get through bylaws, or do you want to take that to the next one, or what do you think?
It's actually pretty quick. I can just give you maybe a quick backstory. So in 2018, we updated the responsibilities for the Board of Health. And so when you guys all, when you started Board of Health, you get the packet and it's got the responsibilities in there. So we updated that document. We just didn't formally update them in the bylaws at the same time. So the only thing that we're asking is to update the bylaws so that those documents are congruent. And then we added in a virtual component since these meetings have kind of changed venues with COVID. So there's just a few updates that we've done, and it's probably been, 5 or so years since we've had an updated signature, updated date on the bylaws. So that's all it is. It's just very minor changes. So we're already functioning under those responsibilities. We just want those reflected in the bylaws. So we just would need a vote and a new signature on that if it's approved.
Okay. Anybody have any questions on the updated bylaws that Lori sent out yesterday? Otherwise, I would entertain a motion to approve.
Breitling so moves as outlined at this meeting.
Thank you. Is there a second?
Ayla did a second in the chat.
Excellent. Love that chat function. All those in favor, say aye.
Aye.
Aye. Any opposed? I think we can call that approved. Thanks, Desi. And then I also see on the agenda vice chair election and that's not new. Is that correct? We typically had a vice chair.
We did. I don't know I think when Robin was maybe here, but then when Robin was replaced by Dr. Newman, we didn't fill that vice chair spot. So we do have an opening for that should technically be filled.
Okay. And I would like to nominate Lynn for that. If she's willing to accept that.
I appreciate the nomination, and I will accept the nomination.
I don't know if we need a second or how that works, but.
I'll second it.
Thanks, Arlette. Okay. Anybody opposed to Lynn being vice chair? Okay. Congratulations, Lynn.
Thank you very much, Chelsea. I appreciate it.
All right. Thanks. Lynn, you've been a great advocate on the board, so I appreciate your willingness to speak up and provide great feedback. So you'll make a great vice chair. So thank you. Okay. Well, as Desi mentioned at the beginning, we did change the next meeting, I believe. So remind me again, Desi.
May 27th. So it's the Thursday instead of the Friday. So it's one day early. Still would be at noon. And just a reminder, this is strictly the budget meeting. So the whole topic is budget.
Okay. Sounds like the Melissa show.
Breitling, I have a question on the handout that we received on revenues. Under Cass County, we only show about 11% of the revenues, although this is supposed to be a quarterly report. Can you tell me why those monies haven't been received or accredited or paid? Or
Yes, this is Melissa, and it's just a matter of timing more than anything. January is a much smaller month to begin with because a chunk of our payroll gets pushed back to 2020. So that showed up on the December bill. And then it's just a matter of me getting the bill to Cass County and it coming back to us. I was gone for 2 weeks in March. And so February didn't get out until very late March. So that, I don't even know if that's back yet. And March hasn't even been submitted yet. So you're only seeing January right now.
All right, thank you. I was just curious about that.
Yep, no problem. Thank you very much for the question.
Okay. Anything else? Okay. Well, thanks again, everyone. And Desi, good luck. We'll be thinking of you. And hope everybody has a great weekend.